Hello, students. So, for this chance, I'm going to explain about the necropsy techniques in poultry. This is also one part of your practice sessions. Uh, Maybe next week you will do necropsy of chicken and other animals by yourself. So, before we do necropsy in chicken, because in many cases the chicken is still alive before we perform necropsy, we can check the antemortem or the animal's clinical signs, okay, while the animal still alive. And then when the chicken is still alive, you can collect the blood samples. You can uh, collect the blood samples from the wing vein by using needles. And then, or you can take blood samples, okay, by using needles or syringe from the heart directly. This is what we call as intracardial blood collections. And then we can also take blood samples and then make it as blood smear. We can check also the blood smear after we stain the blood smear with Gimsa or Diffquick or other staining methods. Here, this is the necropsy tools, just similar with the necropsy tools used in other animals. First, when you do necropsy in poultry, put the cadaver inside the waters. We should immerse the cadaver in water in order to prevent the uh, spreading of a materials, the spreading of feather materials into the environment. As you know that the feather materials in chicken may contain some bacteria or viruses that can infect other chicken. Therefore, to prevent the spreading of these feather materials, we have to wash the cadaver using water. And then this is the positions of the cadaver. The cadaver lies on the back side. And then we cut the thigh. And then after we cut the thigh, we can a bit expose the femoral head. Here, just like this. And then after that, we can perform an external inspections in the chicken. After that, we remove the skin. You can remove the skin by using hand. And for opening the abdominal cavities, you cut at the middles of the abdomen, and then after you cut at the middles of the abdomen, you can cut in the lateral side of the abdomen, and you can cut also the ribs here. Here you cut the ribs in the left side and also in the right side, and then you push away the keel bone here, the sternal bone. And then you can check the air sacs. This is the abdominal air sacs. Before you remove the other organs, you have to check these air sacs in the abdominal area, because you will break these air sacs after you remove the organs. And then you can check also other air sacs like this. The air sacs will be transparent. Then you can expose the oral cavity, cut in one side of the mouth, and then you cut from nostrils until under the eye. Then you can expose the nasal cavities and also sinus. You have to perform this in the left and also in the right side. This is in the left side. You have to perform similar cutting in other side as well. Then you can check the palatine cleft. We call it as guana in chicken. So in poultry, birds as also, there is a palatine cleft here. This palatine cleft, what we call as guana, is directly access the nasal cavities and sinuses. So if there is some problem in the nasal cavity, there's some changes or accumulation of something in the nasal cavity and sinuses, you can see as well in the guana. And then check the larynx. You can also cut the larynx cartilage. And then you can examine the esophagus, and also here this is the esophagus enlargement we call as crop. Cut the trachea along the medial side of the tracheal ring, and then you can open up the esophagus and the crop as well. The crop sometimes contains feed inside, and opening the thoraco-abdominal cavity, you can cut at the lateral side, at the right and left side. Okay, and then you carefully lift the keel bone here, and then you can push it forward. Just like I mentioned before, examine the air sacs, because the air sac is so thin. You have to check the air sacs before you remove the other organs. Cut the ribs. Okay, cut the ribs. Usually we cut the ribs at the 2/3 or half part of the ribs, and then we remove carefully the spleen and also the liver, and then we cut at the beginning of the stomach. The glandular stomach of chicken, we call this as proventriculus. We cut at the beginning of the proventriculus, and then we carefully remove away all the intestinal organs. First, this is the proventriculus or the glandular stomach. This is the muscular stomach, or we call it as gizzard or ventriculus. This one here, this one here, this is the duodenum. And just between the loop of the duodenum, you can see these organs we call it as pancreas. And then this is the small intestine, we call it as jejunum here. From this end of the duodenal loop until this part here, you can see some small, you can see one small bulge here. This is what we call as the diverticulum macule. This diverticulum macule actually separate between the jejunum, small intestine of jejunum, with ileum. And then you can see this is the cecum, and this is the large intestine. Okay, the colon. And we can check the heart. First, we can carefully examine the hearts, and then you can cut half. You can transversely cut the heart. Okay, and then you can see this is the left ventricle. Sorry, this is the right ventricles, and this one here is the left ventricle. Okay, can you see the wall of the left ventricles is quite it's not thin, okay, quite thick here. And then you can open also the bronchus, and then you can check or inspect the lung. Okay, so if you examine the lung, you can easily dissect the lung and separate the lung from the ribs. And the lungs should be bright pink, okay, bright pink, and also spongy on palpations. And you can see also some postmortem congestion like this. And then this is not a abnormality finding, not an abnormal finding. This is just normal and should not be mistaken for diseases. Okay, this is the chicken gastrointestinal part. Okay, put more tension on this part. Okay, you can see some labels of the organs. And then, yeah, you can also examine the pancreas. Here, this is the pancreas. The color is a bit light brown or creamy colors. And then we can open at the major core features of the proventriculus and gizzard. And then after we cut at the major core features of the stomach, you can see the inner part of the stomach. Can you see there is a small bulging structures here? This is indicate the here small bulging structures here. This is indicate the glands of the proventriculus. And then the gizzard, the muscular stomach covered with thick keratin, we called as coilin. Sorry, this coilin protect the mucosa of the muscular stomach from foreign materials that may hurt the ventriculus or stomach mucosa. Here we can open the gastrointestinal tracts. If you open the duodenum and then if you open the small intestine, you can open it close to the mesenterium. Here you can cut the cecum, and then here there a small bulging just in the beginning of the cecum that indicate structures we called as cecal tonsil. Cecal tonsil contains lots of leukocytes. And then this is the methods to collect the intestinal samples, in particular intestinal samples that will be submitted for histopathology. The intestinal samples put in the piece of card of papers, thick papers like this, and then after you put in the papers like this, you can put it into the formalin. And then for liver inspections, you can cut it with around 1 centimeters, half centimeter or 1 centimeter interval. And you can check also the spleen located attached with the close to the liver, between the liver and the proventriculus. Then do not forget to check out the bursa of Fabricius. This is an important organ. This bursa of Fabricius, the main function is to produce the B cells, and the B cells are responsible for producing antibodies. Okay, you can also measure the size of the bursa. So here you can read that the bursa reaches its maximum size around 8 weeks of age. Then do not forget to check out the thymus. The thymus in, this is the thymus here. The thymus in chicken located at the neck. In mammals, usually thymus located just in the anterior part of the heart, but in chicken, it's located in the distal part of the neck, at the right and also left side of the neck. Here, this is the brush of Fabricius. And then after you remove the intestine, you can see kidney here. And then you can see also the ovaries. Okay, this is immature ovaries here, and this is oviduct here, oviduct. And then you can check the kidney. You have to compare between the right and left side of the kidney, and also check a small structures in the middle of the kidney. We call it as ureter. And there should be a small amount of urates, white urates in the ureter, and it's normal. Here, this is immature ovaries, and this is active ovaries with large follicles. These follicles will be ovulated, and this will become the yolk of the egg. Okay, this is the oviduct. And don't forget, in male chicken, the gonad would be the testis. The testis located in the intra-abdominal. Okay, intra-abdominal, there are a pair of testes. This is immature testis. If it's mature, it will be enlarged, just like the shape of a peanut. And then for taking the brain, you have to disarticulate or severing the head from the neck. Remove away the skin, remove away the muscles, and then cut just above the eye and cut in the lateral part just above the ear. After you cut the calvarium, after you cut the skull, you can remove the skull, and then you can see just under the skull the brain. This is the cerebrum, and this is the cerebellum. Okay, and then do not forget to examine the peripheral nerve. The peripheral nerve can be seen in the thigh muscle. We call this as sciatic or ischiatic nerve, or in the brachial nerve, just in the close to the beginning of the wing, just close to the between the scapular and femur. You can see the nerve. You have to compare the size of the nerve between the right and left side. The same thing procedure also should be performed for the sciatic nerve. You have to confirm the size. You have to compare the size between the left and the right side. Then to access the sacral plexus of the sciatic nerve that located just under the kidney, you have to remove the kidney first, and then you can see the plexus of the sciatic nerve. If you find this plexus of sciatic nerve, please compare the size and the shape between the left and the right side. It should be similar. Here, this is the sciatic nerve. You can cut the sciatic nerve if you want to check it further with histopathology. Then you can cut also the joint. The joint that we should check in chicken is the leg joint, not the wing. The wing also you can check, but most of the cases we do joint examinations in the leg joint like this. Okay, and then after that, if you want to check further the bone marrow, you can cut long bones. For example, this is a the tibial bone, or you can cut also the femoral bone. You can cut it with a bone cutter, and after you cut oblique, the you can cut oblique the uh, bone. You can see the inner part, okay, of the bone marrow. In young animals, it should stain red like this because it contains lots of erythrocytes and still on active hematopoiesis. Okay, I think that's all for my explanations on poultry necropsy. Thank you for your attention. Good luck and see you again.